came across to us most last time was thinking across the whole conurbation in terms of safety and not just thinking about the hospital in isolation from primary care.
This programme is giving us space, allowing us to step back and to create something different by working differently.
I think the whole subject area is challenging in terms of it's allowed the board to take stock and reflect on are we moving in the right direction.
This is a fabulous programme and it's really getting people to think very differently about safety. So what we are seeing is people really beginning to shift their thinking from how much harm have we caused in the past to how safe we're going to be in the future.
Thank you, brilliant.
Super.
That's it.
We've had significant conversations with the emphasis on primary care and safety and quality in primary care. And the first part of that conversation has been to start to acknowledge the wide variation in quality and assurance we've got around primary care, which has been a bit of a breakthrough.
We've really tried to work with our CCG colleagues and our local authority colleagues to look at what our project is going to be about and to look at how we're going to get wider engagement with the clinicians.
I've been on some ward visits and also helped out with the communication around what safety means to us, what quality care means to us as a trust.
We've been in special measures and so the CQC were due to come back to us, which they did. So what we've been trying to do is to take what we learnt last time and apply that within all the CQC measures.
Anything else you want to add?
Can I have me lunch now, please?
There'll be a lot of nodding heads.
Great minutes. Smile, look at the camera.
The physio app, we should be doing something with that. It's not beyond the wit of man to do something, so why can't we do that? The other one was around the black box. Again, potentially piloting it at the Wrightington site. We've had a number of NEVR events and we want to make sure that we've learned from those NEVR events.
Jim Easton very powerful in terms of how we could take really simple technologies like smartphones and apply them to make her safer, better quality and lower cost all at the same time.
There are simple things that can be done that can make important differences. Something simple like communicating with the patient in a way that is easy for them to understand so they know exactly what's going to happen to them while they're in hospital.
What we're planning to do next is look at a case note review for a number of patients who've died, who've been in contact with social care, health care, primary care, secondary care. And then we plan to look at the triggers, look at the safety issues that have occurred throughout those patient journeys.
We don't have that much information available to us in real time, and actually if we're really going to make a difference to patients on their journey through the hospital, we should try and maximise the amount of real-time data we have. So we're going to go back, we're going to look at that, we're going to see what we can do with what we do have.
Just thinking about the measurements of safety and how we might group things together differently to produce a different picture, if you like, to tell us a different story.
Our Chief Executive has committed to contacting his chief counterparts in the other organisation, and they're going to commit to setting up a daily operational call when things are going well as well when things aren't going well, and developing a data set that will inform those conversations.
Utilising the current technology we've got to get system-wide real-time evidence of what is or is not working and how we can flex the system that we've got and system processes to improve safety.
Going forward, everything needs to become seamless. We all have to really listen and understand and actually share all of our vision and our future needs with the patients. We really need to know what it is that the patient wants in order to deliver that as a fully integrated care organisation.
You lift the clapperboard up a little bit, just beneath your chin.
Can I do?
Yeah, and at any point you can clap it.
What? Why?
Just clap it down, see what happens.
Oh, like that, okay.
Strike a pose. Strike a pose.
You know where this is going, don't you?
Yeah.
So learn session 3.
Oh, bloody hell.
It's never like this at Old Trafford.